What would an ideal training environment look like? It would be one in which learners would be allowed to apply the concepts they've learned to clinical cases, collecting clinical data and synthesizing the results, and formulating their own diagnostic and treatment plans. They would practice this in a real-time, high-stakes environment in which they could see the results of the clinical decisions they've made. At the conclusion of the scenario, they could get critical evaluation and feedback from an instructor, and ideally learn from the mistakes they make during the course of the scenario. And all of this would occur in a safe environment for learners and for patients. Veterinary simulation products for immersive learning experiences have been limited to static mannequins that provide minimal physiologic feedback and that are focused mainly on practicing the mechanics of CPR, as well as to task trainers like intubation heads or catheterization models that allow skill development but not clinical decision making. The concept of high-fidelity canine simulation is to provide realistic physiologic feedback, such as spontaneous respiratory movements, that require learners to apply assessment and critical thinking skills in real time to a patient. In addition to physical feedback, a simulated patient monitor provides clinical data such as ECG waveforms, pulse oximetry data, and blood pressure synchronized to the physical feedback provided by the mannequin. Other physiologic feedback includes heart and lung sounds that can be evaluated by a stethoscope. Normal sounds, such as heart sounds, and lung sounds can be simulated, as can abnormal sounds such as heart murmurs, pulmonary crackles, and lower airway wheezes. All of these sounds are synchronized with patient chest excursions and the waveforms on the patient monitor. Bilateral palpable femoral pulses synchronized to the patient monitor are also present. The instructor watches remotely, controlling the simulator with a computer using pre-programmed scenarios that can be changed on the fly if needed. In summary, high-fidelity simulation allows learners to practice in real time, facilitates learning through experience, enforces psychomotor and clinical assessment skills, supports communication and team building, permits and encourages mistakes as a learning tool, and is a fundamentally different way to teach and learn.